Health effects of excessive sugar consumption. Most of us enjoy the way sugar makes food taste and us feel. It adds flavor to a wide variety of foods and drinks, not just desserts and candies but also sodas, pasta sauces, and any number of prepared foods. It's so enjoyable that most men take in about 19 teaspoons of added sugar daily, and women eat or drink about 15. Here's an overview of the 10 health effects of excessive sugar consumption. Number 1. Weight gain and obesity. Sugary foods and beverages are often high in calories but provide little to no nutritional value, leading to an imbalance in energy intake. Excess calories from sugar can contribute to weight gain and obesity, which are risk factors for numerous health conditions, including type 2 diabetes, heart disease, and certain cancers. When consumed in excess, sugary foods can also lead to increased fat storage, particularly around the abdomen, which is associated with a higher risk of metabolic syndrome and cardiovascular disease. Number 2. Type 2 diabetes. High sugar intake can lead to insulin resistance, where cells become less responsive to the effects of insulin, a hormone that regulates blood sugar levels. Over time, insulin resistance can progress to type 2 diabetes, characterized by elevated blood sugar levels and impaired glucose metabolism. Excessive sugar consumption contributes to spikes and crashes in blood sugar levels, placing additional strain on the body's insulin production and increasing the risk of diabetes complications. Number 3. Dental health issues. Sugary foods and drinks promote the growth of bacteria in the mouth, which produce acids that can erode tooth enamel and lead to tooth decay and cavities. Frequent consumption of sugary snacks and beverages, especially between meals, increases the risk of dental problems and contributes to poor oral hygiene. Poor dental health has broader implications for overall health, as it can increase the risk of gum disease and other systemic conditions. Number 4. Cardiovascular health. High sugar intake has been linked to an increased risk of heart disease and stroke. Excessive sugar consumption can raise blood pressure and triglyceride levels, increase inflammation in the body, and contribute to the development of atherosclerosis, hardening of the arteries. Diets high in added sugars are associated with unfavorable lipid profiles and an increased risk of coronary heart disease, independent of other dietary factors. Number 5. Liver health. The liver metabolizes fructose, a component of table sugar, sucrose, and high fructose corn syrup, differently from other sugars. Excess fructose consumption can overwhelm the liver's capacity to metabolize it, leading to the accumulation of fat in the liver and the development of non-alcoholic fatty liver disease, NAFLD. NAFLD can progress to more severe liver conditions, including non-alcoholic steatohepatitis, NASH, and cirrhosis, and increase the risk of liver cancer. Number 6. Cancer risk. While the direct link between sugar intake and cancer risk is complex and not fully understood, there is evidence to suggest that high sugar consumption may promote cancer growth and progression. Sugar may indirectly contribute to cancer risk by promoting obesity, insulin resistance, chronic inflammation, and oxidative stress, all of which are factors implicated in cancer development. Some studies have observed associations between high sugar intake and an increased risk of certain cancers, including pancreatic cancer, colorectal cancer, and breast cancer, but more research is needed to establish causality. Number 7. Mental health. Diets high in sugar and processed foods have been associated with an increased risk of mental health disorders, including depression and anxiety. Sugar consumption can affect mood and cognitive function, leading to fluctuations in energy levels, irritability, and difficulty concentrating. Chronic consumption of sugary foods may also contribute to addictive-like behaviors and cravings, as sugar stimulates the brain's reward centers and promotes the release of dopamine, a neurotransmitter associated with pleasure and motivation. In summary, while sugar is naturally present in many foods and can be part of a balanced diet in moderate amounts, excessive consumption of added sugars, particularly in the form of processed foods and sugary beverages, can have detrimental effects on health. Prioritizing whole, nutrient-dense foods and minimizing intake of added sugars is key to promoting overall health and reducing the risk of chronic diseases. Thank you so much for watching. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel for more content like this. Also, be sure to check out our other videos. You can find them in the description box below. Until next time, take care